how essential is cholesterol for the body? Well, we know that too much cholesterol is bad, but actually everybody needs cholesterol. Cholesterol is involved in the making of the cell membranes of every cell in your body, so we gotta have cholesterol. Cholesterol is also produced in the liver, and it's responsible for every hormone that males and females have. So all of our steroid hormones start with cholesterol, the male hormones and the female hormones. Now the problem is when we get too much cholesterol, and that's by eating and lifestyle changes of not having enough exercise. So let's pretend we've got some cholesterol made by the liver, and we've got a little choo-choo train that carries it along to the cell membranes and to the blood in right amounts. And we start eating improperly, we don't exercise, that train gets overloaded as it's carrying the cholesterol, and it dumps some off. Some falls off the train, and that goes into the blood vessels. And when it goes into the blood vessels, we get hardening of the arteries. Total cholesterol, you need to know what your cholesterol number is. Your total cholesterol should be less than 200. There are two types of cholesterol that you know about, and we need to review those numbers. Number one is the LDL, that's the low density, that's the bad cholesterol, that's the lousy cholesterol, that's the cholesterol that goes into the blood vessels that clogs them up. And if there's too much LDL, you can get hardening of the arteries in the brain, you can get hardening of the arteries in your coronary vessels and get heart attacks, you can have strokes, you can have abdominal aortic aneurysms bulging out of the arteries. You can get peripheral artery disease where you don't get enough circulation to the legs. So your LDL needs to be less than 100. If you've had a heart attack or if you've got some risk factors of heart disease, then that LDL needs to be down around 70. The HDL goes around and picks up the bad, and so it's good to have as much happy cholesterol, HDL, as you can possibly get. Men, it should be greater than 40. Women, it should be greater than 50. The cardioprotective number is 60. So the good cholesterol, you want above 60. The bad cholesterol, you want below 100. There's another fat called triglycerides. It should be less than 150. If it's too high, your doctor will put you on an exercise program, an eating proper program, and if he has to, there are wonderful medicines that can lower your total cholesterol.